Hi, this is Kara Rose Atkinson, a licensed marriage and family therapist and president of IE Camped, and I am now here with Annabelle Parr. So, welcome, Annabelle.
Thank you.
Can you tell us a bit about you?
Sure. So I am an associate marriage and family therapist working towards licensure. I work for a couple of practices here in San Diego. So I work for the Center for Stress and Anxiety Management and San Diego Psychotherapy, Inc. And I specialize primarily in acceptance and commitment therapy. And the populations I tend to work with are generally folks struggling with some sort of anxiety or anxiety disorder. Um, so
Yeah, welcome to the world.
yeah,
Welcome to the world under COVID.
yeah.
So, the first thing that crossed my mind when I looked at this, because I don't know about acceptance and commitment therapy, is that like positive psychology?
That's a great question. I would say it's probably somewhat similar. However, maybe a little bit different as well. So the primary goal with acceptance and commitment therapy is called psychological flexibility. So
Okay.
we're really working to help clients build psychological flexibility. And so um, whereas I tend to think of positive psychology, and I don't know if I'm even correct about this because I don't know as much about positive psychology as I do about ACT. Um, I tend to think of that as kind of more of, like positive thinking, whereas acceptance and commitment therapy isn't necessarily about thinking positively. It's about changing the way that you're relating to your experience in such a way that you are open, aware, and engaged in your life and moving towards the things that matter to you. So, yeah, I imagine there's a bit of overlap there, but that's the specific um, goal that ACT is working clients towards. Does that make sense?
It does. And where does this come from? Who just made it? Is it you? Is it somebody else? I don't know enough about it. So
Definitely, it's not me.
Mm.
So the creators are, let's see, Dr. Stephen Hayes is kind of the
Okay.
primary guy, but there's a few other folks involved as well who really formulated this theory. I believe Kelly Wilson. Oh dear, and there's a third person whose name I am so sorry is slipping my mind, but
It's okay.
Stephen Hayes is the main man as far as I know.
How long has it been around?
I believe it was started to be developed in the 1980s, and then really gained more of an evidence base and more popularity, in the past, gosh, what is it now? 30 years, I suppose. And it's been gaining popularity.
Yeah,
So
I mean, so it's evidence-based. I mean, for those
mhm.
people that are not therapists, because there's going to be people that are
Mm,
watching this that aren't, that means, when it comes to insurance, when it comes to uh, community behavioral health, we are showing proof that it is actually working and progressing and those goals are happening. And it's
mhm.
so important because, I mean, ethically speaking, should we be doing therapy if somebody is not moving forward?
Right. Totally.
So evidence-based is always great. Whenever I'm doing like a court case, I always
Mhm.
go to a modality of evidence-based,
Mhm.
so I
Yeah,
can make it clear.
right.
And it sounds like your heart and my heart, my company is the Trauma and Healing Foundation. So having, this trauma and or whatever you want to call it, life,
Mhm.
that has affected us. So how does it work for you? Like, what's a first session look like?
Oh, good question. So after I've done kind of the initial intake evaluation to get a sense for what's bringing the client in, generally the first session where we really kind of get into things, I tend to do an exercise that's called creative hopelessness. So essentially it's around creating some hopelessness around the agenda of like controlling our internal experience. So once we can help show clients that all the things they're doing to try and control and manage and kind of stuff all the uncomfortable internal stuff that's showing up for them is maybe not working in the long term, even if it works really well in the short term,
Sure.
then we can get to a place where we have openness to an alternative and to kind of teaching more skills around being willing to have our internal experiences that are uncomfortable and still move towards the things in our lives that matter to us. So, and basically what that involves is helping clients to look at what is the painful stuff that shows up for me. What do I do to try and control that? Whether that's like healthy or unhealthy stuff, or what am I not doing? You know, and I put that in quotes because it's easy to label like exercise as a healthy behavior, or but
Or it could be
sometimes
an addiction.
right, sometimes the function it's serving is to try and stuff, you know, your anxiety or whatever is showing up for you. And then we kind of look at, so what is the benefit of that? What are those behaviors getting you? And then what are the costs? Are there any costs to you in the long term? And if so, can we check that out?
Right. So I'm just kind of writing some ideas here, the limiting belief systems that we hold that it sounds like it's getting to. I'm involved in transformational training. We call those the costs and then the goodies that come with it. You know, those things that everybody says, oh gosh, there's nothing good coming from me thinking that. Well, let's rethink that, because
Right.
we don't do things that don't offer some reward.
Right. Everything we're doing makes sense in some capacity, even if it's costing us in the long term.
Right.
We
I
don't
mean,
do
so
things
that
for
can
no
help their
reason.
brain to shift so that they can realize that they're fighting to be a victim and don't know it.
Yeah, and I think it can really help build compassion too when you look at like, oh, well, of course I'm doing this because it works really well in the short term. Like it's really reinforcing to get that immediate relief that you might get from whatever it is you're doing now.
You mentioned anxiety. Of course, anxiety is, you know, the catch-all these days. Do you tend to find people that are having addictions, you know, personality disorders? Like, what do you tend to see?
Yeah, so I tend to specialize pretty specifically in anxiety and related disorders. So
Mhm.
usually if there's another kind of co-occurring concern, that tends to be a little bit outside of where I specialize. So in those cases, I might refer to someone who has a little bit broader of a scope. But yeah, so, you know, anything under the anxiety disorder umbrella, and then I say related disorders, so OCD, PTSD, you know, that kind of used to, I believe, be under the anxiety disorder category, but have since been kind of reclassified in other areas, but
Yeah.
function in a relatively similar way.
Yeah. I mean, I'm the same thing. To me, I'm an expert in anxiety-based disorders, however they show up. And they could show up. I myself was a compulsive eater. You know, sometimes people do drugs and alcohol and they have the co-occurring. Sometimes, you know, it's that anxiety shows up in so many different ways. And I always tell my clients, and I don't know what you tell yours, is that anxiety is the living in the future, you know, and the future of the what ifs. Oh my God, what if that thing happens? But if you live in the day, the hour, the minute of the heartbeat, then, you know, we're grounded, and the anxiety can kind of mellow out. What do you tell your clients?
Yeah, so, you know, very similar. So, one of the things that I often bring up with folks is how uncertainty and like a intolerance around uncertainty is often at the core of anxiety. So, you know, similar to what you're describing, uncertainty about the future, know what's going to happen. We don't know. And we don't get to control that. And so, I know, I know. And so, you know, a big part of ACT as well is helping really put folks in touch with their present moment experience and what can I control in this moment, my behavior, what I'm going to choose to do with my mouth, my hands, my feet, where I'm going to move in my life. I don't get to control the outcome. That's going to be uncertain. I don't get to control my internal, you know, my emotions, my thoughts even, but I can shift how I relate to that experience where I'm willing to have it and still choose to take action towards my personally held values, the things that are important.
You know, so interesting because I have a long background in recovery, and we talk about being comfortable in your uncomfortability. You know,
Yep,
and that's kind of what you're saying. And,
very
you know,
much.
working through what they can handle, what they can tolerate, and keeping it a smaller chunk. How do you take a bite out of
Mhm.
an elephant? You know,
Mhm.
one bite at a time, and sometimes it's 1 minute at a time.
Yeah. Yeah.
So it sounds like,
Absolutely.
there's a lot of overlap with that, and recovery in itself can be anything. Like I said, my drug of
Mhm.
choice was food, and
Mhm.
it hasn't been for 10 years. So then, you know, I guess I get to live on life's terms,
Mhm.
and
Yeah.
also to accept, like you say. I'm currently writing a book, and it's all about acceptance because it's so
Mm.
important. If we don't accept, our faults, we don't change people, places, and things. We're lucky just to uh, control what comes out of our mouth.
Mhm.
And if that happens, that's a good day.
Yeah. Yeah, absolutely.
So there's so much similarity and overlap. I definitely have an interest in this. What book would you recommend for this? So because I'm kind of
Ooh.
curious.
Yeah, great question. So in terms of books, if you are looking for kind of um like a good one that's accessible to either clinicians or clients, it's specifically written for women, but a lot of it applies broadly as well. So
Hmm.
it's called Be Mighty,
Be
and it's by
mighty.
Dr.
Okay.
Jill Stoddard.
Okay. So maybe I'll get that information from you as well.
Yeah,
Can
absolutely.
so that we can get your information out there. What is your website?
Oh, that's a great question. So, like I mentioned, I work for two practices. So, one is
Hmm.
CSAM,
Hmm.
and the other one is believe the handle, I'll have to double check. I believe it's shoshanashay.com is the website for San Diego Psychotherapy Inc. I should know that, but I want to double check and
Well,
make sure.
just let me know, and we'll put it into the.
I'll confirm. 97% sure I'm correct.
What? You're not perfect?
No, believe it or not.
I mean, well, that's the thing is everybody is walking around going, "I'm supposed to
Right,
be perfect."
right.
Impossible.
Impossible.
And yet they're living with those ideas, and that's not acceptance.
Mm-hmm.
I'm human, and
Right,
I have faults, and
right,
I'm good enough just the way I am.
right. And even creating some acceptance around the thoughts like I should be perfect. Like, okay, so maybe
Oh,
your mind is telling you that.
right.
Can we make some space for that thought too? Like,
Yeah, in recovery, we talk about shoulds and musts. Gotta go.
gotta go.
We gotta go. I mean, there's other words that they use to describe it. I won't say that because it's a cuss word. But shoulds and musts are us, hitting ourselves with a hammer, right?
Hmm. Totally.
Yeah.
Yeah.
So it sounds really interesting. I definitely am going to learn about it. Our training is coming up on the 28th from 9 to 11.
Yep.
We're going to be sharing this, but if you know of some groups that it would be helpful for, please share. Um, I don't want to scare you, but we've already got well over 70 some people, and we haven't even
Wow.
done this video. So we have the webinar, so we can go as high as we need to go. And we would love to have you there and love to learn new things because we can never get enough things in our toolbox.
Mm-hmm. Very true.
Yeah. So thank you so much, and you have a great day. If you want to hold on a second, I'm going to say goodbye to the audience,
Sure.
and then we'll just make sure all is right technologically. And anyway, everybody, I don't know what your weather's like. Currently, ours is a bit cold, which I'm glad because it was 90 something last week. But stay safe. These are not easy times, so stay safe and remember to do your own self-care. And with that said, we'll just have a great day. All right. Bye-bye. I have turned off the recording. And then I'm going to also um, see if I can shut off. Yeah, and then I'll shut this off. Okay. All right, great. I'll let you know if there's any problems because I'm going to check it as soon as it downloads, and then I'm going to get it onto YouTube, my YouTube, Camp's YouTube, and then it's going to be all over groups. So
All
I don't
right,
know
awesome.
what groups are you in?
Oh, that's a good question. Like Facebook groups and that kind of thing.
Yeah.
I'm in a group for anxiety specialists. I think what else. And then the practices I work